So welcome to the Doctor's Edition. I'm Dr. Rita McGuire, the Chief Medical Officer and one of the co-founders here at Wakana. And each and every Tuesday at 7 p.m., we do what we call the Doctor's Edition, really focused for healthcare professionals to understand the difference between CBD and medical marijuana and to really understand how the cannabis plant works in our body and some of the products that we offer here at Wakana. So a little bit about myself. I'm an obstetrician gynecologist of over 30 years. I attended Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County Hospital, which is now Stroger Hospital in Chicago. And I am CEO of RJM Wellness and Ripped Rita Fitness. I'm also a global women's health and wellness speaker. I'm a physician that certifies patients for their medical marijuana cards in Illinois, as well as I'm a member for Doctors for Cannabis Regulation. Again, I'm one of the co-founders and chief medical officer of Wakana. Well, I want you to meet our medical advisory board. And you know what? I think I have two potential members here, right here. I'm about to do their bioscans, but they're two nurses. They're here. They're part of Wakana, right? And excited to put them on this incredible group of men and women that are healthcare professionals, our medical advisory board, made up of physicians, nurses, clinical psychologists, pharmacists, chiropractors, dentists, and naturopaths. So excited for this advisory board to grow. So let's talk about why cannabis is mainstream. Well, my colleague, Dr. Sanjay Gupta, really is the reason for cannabis to be mainstream. See, in 2009, he made a pretty harsh statement about cannabis. He said there is absolutely no medicinal benefits for cannabis. In fact, it's a Schedule I drug. There's some safety concerns. There's some addiction concerns. There is a lot of concerns. So he had said no to cannabis. But he had to eat every single word he said in 2014 when he came out and made a public apology. He said, I didn't dig deep enough. I didn't dig far enough in the research. I didn't talk to enough chemists. I didn't talk to enough lab specialists and experts. More importantly, I didn't talk to enough patients that have absolutely found that this plant has been beneficial for so many different conditions, like seizure disorders, like the little girl by the name of Charlotte Fiji, who has or had, unfortunately, Charlotte Fiji passed away from complications due to COVID. But this was a little girl who has had 300 seizures a week. And it wasn't until her parents introduced her to the cannabis plant, this little girl went from having 300 seizures a week to 3 seizures a week. So Dr. Sanjay Gupta really has helped us to understand the medicinal benefits of the cannabis plant. So when we look at the plant, there's really two main species. There's the hemp and the marijuana. The marijuana, we know, it gives you the high, the euphoria, the paranoia, and the munchies, right? And the hemp plant, which is what we call the health without the high, it has not only medicinal benefits, but industrial. In fact, we're seeing a lot of homes being built from hempcrete. We know that the very first automobile, the Model T Ford, was constructed from hemp. We know the very first Bible was constructed from paper made from hemp. So it's really the hemp that we are looking at tonight, that we're going to be focused on tonight. Hemp has very low levels of THC, 0.3% or less, and marijuana has high levels of THC. And this is why marijuana gives you the high and hemp gives you the health without the high. So other characteristics that make marijuana differ from hemp, Well, one is that marijuana is grown very carefully. I mean, both are grown very carefully, but marijuana has a much shorter growth cycle than hemp. In fact, the growth cycle is about 4 to 6 weeks, where hemp is a little longer. Again, we talked about the percentages of THC are very high in marijuana, whereas hemp, it's less than 0.3. We talked about the fact that there's many industrial uses for hemp versus marijuana, which is very little. In fact, you can find hemp underwear, you can find hemp clothing, and even there's a lot of shoe industry companies that are now making hemp shoes. And in 2018 is when the Farm Bill legalized hemp. See, hemp used to be a Schedule I drug, a drug that had no medicinal benefits to the body, had some very severe safety issues, and also had some issues that were concerning for addiction. Well, in 2018, the Farm Bill legalized and removed hemp from being a Schedule I drug as long as it contains the legal limit of THC, which is 0.3. So when we look at what the FDA is approving as it relates to CBD, where there's only one FDA-approved medication, it's called Epidiolex. It is manufactured by GW Pharmaceuticals, and it is a drug that's used for children to treat seizures. Lennox-Gastaut syndrome, Dravet syndrome, and tuberous sclerosis complex. These are all conditions that children may suffer from, and this is a medication that, quite honestly, is very expensive. It's $3,200 a month, and this is the only approved CBD prescription drug. So it's made in the lab, it's synthetically manufactured, but just know it is the core of the pharmaceutical medication is CBD. We have other medications like Syndros and Marinol and even Sesamet. All of these medications are approved in the US. They are THC-based medications, and they're used for severe pain. They're used for nausea and vomiting in those who have side effects from chemotherapy. And then there's other medications not approved in the US, but are very, very popular in the UK, Sativex. So again, this is a 1-to-1, 1 THC, delta 9 to 1 CBD. But again, these are prescription only medications. And it's important that you as healthcare providers understand the importance of utilizing CBD in your practice and even personally, because so many patients are really sick and tired of all the side effects. Many of our patients are on 10, 12, 15 medications because of side effects from one medication that warrants another to address the side effects. So people are looking, our patients are looking for a holistic option for their health. So see, these are some of the top reasons people use CBD: for relaxation, for stress, anxiety, to improve their sleep, to relieve muscle pain or chronic pain or joint pain, to offset nausea, to really help with dysmenorrhea, menstrual relief, and even sexual enhancement. We see baby boomers are using more CBD. The percentages each and every year have increased. Even the millennials, the Gen Zs, their percentage of usage has increased as well. So let's look at CBD. CBD, or cannabidiol, has a lot of medicinal benefits. In fact, there are 20,000 peer-reviewed articles that you can find utilizing CBD. Now that it's legal, you're seeing top research institutions and universities, UC San Diego, they're doing research with humans with CBD and its therapeutic relief in ADHD and a lot of eating disorders and stress and depression, anxiety. The research is really, really accelerating each and every year. But CBD or cannabidiol is the main cannabinoid the plant makes that has more medicinal benefits. The benefits range from being an antibacterial to being neuroprotective, to helping to relieve pain and anxiety, to even improving blood flow as a vasal relaxant. But there are other cannabinoids that you should know about, like CBG and CBC and delta 8 THC. These all synergistically work together with CBD to really help on a cellular level to see relief in a lot of conditions. When we look at the plant, those cannabinoids are called phytocannabinoids. There's over 180 or more phytocannabinoids identified today. But how about our body? Our body produces cannabinoids, just like the plant. They're endogenously produced, so they're called endocannabinoids. The two main endogenous cannabinoids are anandamide and 2-AG. They help to put the body in balance. They give us joy and bliss, because ananda comes from the Sanskrit word ananda. It means bliss or joy. And then 2-AG works very much like CBD. It helps to relieve inflammation in the body. So when we look at what we face every day, the air we're breathing, the food we're eating, the water we're drinking, that tap water, which is, oh God, I'm a water snob, you can understand why these endogenous cannabinoids are deficient in our body, right? So we understand that we have to utilize CBD each and every day to keep our body in balance. So the science behind how cannabis works in the body is fascinating. In 1990, the endocannabinoid system was discovered. In fact, it is deemed the most vital regulatory system in our body. It regulates homeostasis, balance. It's made up of receptors. CB1 and CB2 are the main receptors in the endocannabinoid system. But these receptors, when you consume CBD, they bind and send messages to different areas of the body to reduce anxiety, to reduce stress, to help us sleep, to improve our metabolism, to improve our blood sugar, our blood pressure. So these receptors are found in major organs and glands: our heart, our lungs, our liver, our kidney, our skin, our teeth, our stomach, our reproductive tract, our uterus, our ovaries, our testicles, our brain, and our central nervous system. So they're situated in major organs and glands. Now, another thing we have to think about as healthcare professionals is how does CBD interact with other drugs? Many of our patients are on many drugs, right? So CBD is metabolized in the liver, so it can inhibit medications that our patients may be on, or it could potentiate medications that we may be on. That's why it's so important as healthcare professionals that we understand how cannabis works. So there's two main drugs that you should know about that CBD can interact negatively, and that is warfarin or Coumadin, it's a blood thinner, and theophylline. It's an old medication we use for asthma. I don't know many practitioners that still use theophylline, but just know these are the two main ones. So you may, when dealing with patients, have to monitor their blood levels. It's not that they can't take CBD, but their blood levels may need to be monitored a little bit more frequently. Another concern is CBD and drug testing. Many of our patients have random drug testing. So when we're recommending CBD, just know that topicals don't pass the blood-brain barrier. So topicals are great ways to utilize CBD in those who have random drug screens. And then we have something called a broad spectrum product. Our broad spectrum CBD contains less than 0.0% of THC and are a great option for those who have urine drug screens. There was a study that showed that you would absolutely need really high doses, between 1,000 and 2,000 milligrams of CBD, that have the legal limit of THC, which is 0.3, you would need between 1,000 and 2,000 milligrams a day to have 11 to 23% chance of even detecting that in a drug screen. But we want to ensure that our patients keep their jobs, right? We don't want anyone losing their jobs. So recommend the topical and or a broad spectrum product. And we'll go over some of our products. So there is a very specific and sensitive urine drug screen out there. LabCorp offers a CBD to THC ratio. It is the best test for employers to use because when you use point of care testing, drug testing, it's not very specific, right? It doesn't know the difference between CBD and THC. So utilize the CBD THC ratio by LabCorp so it can determine if a patient is utilizing CBD or if they are utilizing THC. So there's a lot of things you've got to take into account when you are recommending CBD products to your patients, or your patients are asking you to recommend a product to them. You want to recommend a reputable company like Wakana, a product where our products are grown organically, our products are extracted in a very clean extraction method, supercritical CO2 extraction method. Our products are third-party validated and tested. And every product comes with a certificate of analysis. And so the supercritical CO2 extraction not only is the cleanest method of extracting hemp or extracting CBD from the hemp biomass, but it's also the most efficient and safest for the environment. So it gives a very clean and potent product. And there's many ways you can consume CBD. And that's what's so great about CBD. You can use it as a tincture. You can use a smokable. You can use a water soluble. You can consume CBD in an edible, like a gummy. There are capsules as well as topicals. And then the research. You want to utilize a lot of research from PubMed. There's great articles. In fact, this article from Ethan Russo, who discovered the clinical endocannabinoid deficiency. That is a real syndrome where folks who have migraines and fibromyalgia, hyperemesis, dysmenorrhea, there are specific medical conditions where Ethan Russo did research that shows that the endogenous cannabinoids, when they become deficient, they will cause some of the most difficult medical conditions that we try to treat in medicine that were not very successful. So these articles from PubMed really help you to understand how CBD can be a potential treatment for anxiety disorders, for cancer treatment side effects, for GI disorders, etc. So let's run through some of our products. Our product line, again, we do third-party testing. In fact, the lab is right here. I'm in Fort Lauderdale, Hollywood area. Our lab that we utilize is in Davies, Green Scientific Lab. So I'm able to visit a lot when I'm down here visiting my gym, but just know they have state-of-the-art equipment. They do all of our testing from potency to pesticides, heavy metals, residual solvents. They even test the terpenes in our products. So we have very safe and effective products. Our FDA disclaimer just states that these products are not intended to diagnose, treat, cure, or prevent any disease, and that all information here is not meant as a substitute or an alternative to information from your healthcare practitioner. Please consult with your healthcare professional before about any potential interactions or other complications before using any product. The Federal Food, Drug, and Cosmetic Act require this notice. So we have a line of tinctures that include our power or our full spectrum and our pure, which is our broad spectrum. Again, the power are for those who can utilize the legal limit of THC, which is 0.3%, and the pure, the broad spectrum, are for those who can utilize CBD if they have random drug screens at our job. Start low and start slow. Our products are incredible. So start with 3 drops twice a day. And if you need more, you can always increase that dose. We also have a water soluble. It's a great product that you put in your water, your juice, your tea. And we have more of a therapeutic product called Hemp MD. That's our most potent product, which is 900 milligrams versus the 300 milligrams in the pure and the 500 milligrams in the water soluble in the Hempranium 500. Then we have our topicals. Our topicals offer local relief to those sore muscles and joints. I've worked out like twice today, really hard this morning, but I taught another class about an hour ago, and I absolutely utilize our extreme power pain cream. I utilize the Dr. Reader's rub, and we also have other products to help nourish the skin. Our facial serum, our Holy Glow for those areas that may have some issues due to skin disorders like eczema, acne, and psoriasis. We have products that help with these dry hands, right? We're washing our hands so much. Our Power Mango Body Cream. We have some topicals that help to get you in the mood, right? Our body butters with hibiscus and lotus and CBD as well. And then our edibles are absolutely incredible. Our power gummies, our pure gummies, our Delta 8 gummies, our King of the Jungle gummies. So we have gummies that assist with low libido and stamina. We have gummies that help reduce inflammation and pain. We have gummies that are our Delta 8 for that person who needs more creativity, or that person that really needs more of a potent CBD product that is very close relative to Delta 9. That's our Delta 8 gummies. And then our essential oils. We have something called our First Defense. This is a nasal spray. It also includes our CBD along with essential oils to really help to address those microbes, those viral particles and bacterial particles that can enter through our nasal passage. We have lemon and black seed and peppermint, just all organic essential oils are incredible. Our smokable product is our Delta 8 pre-roll. Right now, that is our smokable product. Smokable products work fast, within 1 to 5 minutes. They can get into the bloodstream and really provide relief to the body. And then our culinary products. Yes, we have CBD spices, vegan butter, and we have a culinary plus. So you can bake and cook with CBD. So we have a lot of different options in utilizing CBD. We even have hair care products. We know another global pandemic is called alopecia, hair loss. Alopecia is a global pandemic. Men and women are losing their hair all over the world. Why? Well, COVID has caused a lot of hair loss. Now, it's temporary. It's called telogen effluvium. It will grow back, but we have products that will assist with hair thinning and hair loss as well. We even had to pivot during the first phase of COVID. We had to make a pivot, and we have a sister company called Royal Defense. So we have products that help to sanitize and keep your home safe, your office safe, your produce safe. Who wants to wash their produce off with Lysol and Clorox? Nobody has time for that, right? And then our sexual health products, our CBD lube, our King of the Jungle gummies. These are great products to enhance those who may have loss of libido, vaginal dryness, and issues with erectile dysfunction. So there's so many great choices. You can't go wrong. We are the crown jewel of CBD. I want to thank you for joining. If you have questions, comments, suggestions, critiques, whatever it is, please contact me at ritamd@wakana.com. That's ritamd@wakana.com. I want to invite you to our 8 o'clock call. It's an overview, our Wakana business overview. That's in about 35 minutes. Here is the Zoom link, the Zoom ID, There is the passcode. If you want to hear more about our business opportunity, if you want to hear more about our products, if you want to hear more about our vision and our mission and our leadership here, you want to join the call. So I want to invite you, whoever invited you out this evening, please connect with them. Please connect with the person who invited you so you can get more of your questions answered. You can get your products ordered, and you can join us at 8 o'clock. So be well, be safe. I'll see you in about 35 minutes. We will see you next Tuesday at 7 p.m. Thank you again for joining.